Hey guys, she was just swearing. Hey,
Oops.
this is Laurie Edge-Hughes. This is going to be amazing. I absolutely adore this woman. So she's looking fab. She's over in Canada. They haven't got lockdown, so she's had her hair done. And she is here to talk to you all about manual therapies. So let's crack on. Tell us about you so people can have all this faith and belief of what you're going to say is going to be awesome.
Ooh, okay, that it might actually be legit.
Yes.
Okay. So I am a physiotherapist trained here in Canada way back in the early 90s. And let's see. So I started doing horses when I was in my third year of physiotherapy school. And then I came out, and my second job was working for a lady that essentially started the animal rehab group here in Canada. And so I was involved with that, learning my human skills, taking animal courses, which were mostly horses. Oh, no, we're losing our willing participant.
Anyway. No, Karma, stay.
Stay.
So beautiful.
So anyway, so then I was around at the right time. We started the Canadian Horse and Animal Physical Therapists Association. We were doing courses on horses. I started dabbling in treating dogs. So I read everything I could and created the first canine physiotherapy course in Canada. I taught the first one in the US. That was back in 99. Taught the first one in Australia in 2001. Let's see. And then basically have worked out of my home office, doing house calls, working out of vet clinics. And for the last 17 years, it'll be tomorrow? No, on Tuesday. 17 years, had a standalone rehab referral center in Calgary.
Which is beautiful, because I've watched the videos of you, using your facility, doing your, you did a brilliant video series about prepping dogs for agility, for the sporting season. And you had all these different stations that they had to go through to physical fitness. Oh, where are you at? And it was like, this place is massive.
There's another room and another room and another room.
They all had arrows on paper. Go there, go there, go there. And you did something like 70 people a day or something. It was crazy.
Oh no, it was awful. It was 17 because, 17. But oh my gosh, they were all there for 2 hours. Anywho, yes. Yeah, that. I got my master's degree in animal physiotherapy through the University of Queensland in Australia. I taught for the Canine Rehab Institute down in the US for about 10 years. Devised the curricula for our diploma in canine rehab here in Canada.
You've been busy and you still look very young. It's ridiculous.
I started when I was 5. And what else then? I'm sure I've forgotten some things.
You actually do fourleg.com. Don't forget that.
Oh, good gracious. Yep. Fourleg.com is an educational platform for other canine rehab professionals to learn more, to remind themselves of what they forgot. It's basically 10 years of just purging stuff in my brain. So that keeps me busy. I am the advocacy lead for the animal rehab division of the Canadian Physiotherapy Association. So I do the political stuff because nobody else wants to.
I don't know how you fit it all in, because you're also still working.
Yes, and I work at the clinic 3 days a week.
Yeah. And then, so we will put all the links and.
Well, I always feel bad saying it, but if nobody else will. And then in 2020, I was voted the canine rehab therapist, animal rehab therapist of the year by the International Association of Veterinary Rehabilitation and Physical Therapy.
I know. I saw that.
Inaugural award. So
I know. And to be fair, it was very well earned. But we're going to put all the links. So for what Laurie does, we'll put some links down so you can all catch up. And then we've got a great special offer following tonight so that you guys can learn a lot more from Laurie now. And then you can follow on and do a course about massage thereafter. So I have an agenda. And now that we're going to crack on, first of all, we need to actually clarify what a PT does compared to, say, a vet like me, because you see the world different. And I think the followers need to understand your your sight, what's going on in your brain when you're looking at a dog compared to what maybe a vet would.
Yeah. Oh, absolutely. So as a physical therapist, so PT, physical therapist, I always say physical therapist is the term used in the United States. Physiotherapist is the term used in the whole rest of the world. And Canadians wanting to make everybody happy, we use both terms interchangeably. So if I say one or the other, I mean the same thing.
Yeah.
So we are all about, and this is Karma. There we go. She's our willing volunteer if I hang on to her for this demo.
Okay. It's all color matched as well. What's quite incredible, everything actually matches quite nicely.
She's like, not so sure. Oh, there we go. I had to hide these in the room here before she got here, or she'd be maniacal. So
cool. Yes. So what do you see?
Back on topic. A physiotherapist. Oh my goodness. And now we all get paranoid when we cough.
Yes.
A physical therapist likes to look at function and a lot about correlations, right? So the old song, the hip bone's connected to the spine bone and the spine bone's connected to the whatever else bone is all very true and relevant. And that's what I hope to kind of get into a little bit today as well. So function is, so it's not just, okay, there's arthritis in the carpus, but how is that affecting the dog? Is it, well, for one, okay, you go this way for a minute. Is it something that's actually affecting the dog or not, right? Because you can have arthritis on x-ray and no clinical signs, but if you've got arthritis and it's causing problems, it causes problems not just in that joint. So it can cause problems on up the chain and onto the other side. This is what I was worried about.
It's fine.
There we go. Right up to the other side and into the front or the back and into the spine. So it causes issues a lot of other places. And then it can be something where it's like, okay, I see my dog is sore, but a lot of times what the owners are noticing is that, you know, my dog can't go up the stairs anymore or can't hop on the bed anymore, or she's really sore. I had one just contact me the other day and it was like, she says, you know, she's been so sore after we went mountain biking, well, fat biking, right? So fat tires, anyway, fat tires. So, and she loves fat biking, but she's been limping and sore ever since, you know, so that's function. That's the stuff that, you know, the owners are noticing that people want to do. And she's like, but my dog loves doing this. So how can we still do it? So looking at function, one, what can they do? What can they not do? What is it preventing them from doing? What are the other parts of the body that are being affected by, you know, let's say this carpal arthritis. So we look at all that big picture in through there. And then some of the things that we can offer are the non-pharmaceutical management things. So we are, I will say, very much an adjunct to your traditional veterinary care.
Definitely.
Because, you know, you still, the medications are still important. I'm so afraid to let her go that I will have to run around and we're live.
We can do that. Don't worry about it. I'll fill in the gaps for you. But I think it's really fair to say that, like, I'm vet trained, and all of my studies when I was learning arthritis management at university was very pain focused. It was all focused on pain, and there was very little about returning function and returning to the activities of daily living that they had before. And that's why these two things marry up really well. And they shouldn't be seen separate. They really, really combine symbiotically to get that owner and dog back to the quality of life they had before. So when we teach, we talk about rebuild, and we don't talk about rebuild just tissue-wise. We talk about the relationship, because a lot of times a diagnosis of arthritis starts closing doors on the activities that that dog and that owner did together. And what you're saying is, well, actually bring this into your life and maybe some of those doors will stay open. They might not be fully open.
Right. They might be modified.
Yes.
Modified.
Cool. Okay, so when you are looking at a dog, just give the followers a few things that are going through your head. So do you look at muscle? Do you look at posture? What kind of things would you be seeing that maybe a vet might not be seeing?
Okay, so first off, we all, regardless, we all look at the gait, how the dog is walking, right? So you look for the lameness, right? It's not just the lameness. In part, it's also movement compensations, right? So are they shifting more forwards or more backwards? Do they have a roach in their spine because of how they're moving? Do they waggle only one direction now? So we've got aspects like that. So it's not just are they lame or not, but are there other compensations that we need to look at? And I find that different because when I did my master's degree and I am doing the horse lameness evaluation, and the examiner asked me, says, okay, Laurie, is that horse lame or not? And I started down the path of, but it's not right. She's kind of short striding here, and she's not, moving quite right on this side, and she's kind of moving the leg a little bit more internally. And she said, Laurie, is the horse lame or not? And I said, no. Because according to a vet standard, that horse was not lame.
Yep.
She wasn't right. So that's kind of the thing is all those little extra stuff. Okay, so then that's one point, right? So then your next thing might be, so we look at the joint, and this is where my willing participant comes into play, right? So if we look at the next one, right? So I want to see, does she have full range of motion? And actually, this is not too bad, right?
For a 9-year-old, it's very good.
For a 9-year-old, yeah. So full range of motion, but if I give it a little bit of overpressure, like taking it to the very end range, can you see her just flinch ever so much, right? There.
Yeah.
So end range, so she likely has early degenerative changes in that carpal joint, which at 9 is not uncommon.
Totally expected.
Right. So not only is it looking at the range of motion, but is there pain with the range of motion?
Yeah.
Then I want to go up the whole chain, right? So, what is her elbow like? And I'm sorry, I need to buy a whippet just so I can do these things. So you can see, right? So her elbow's actually pretty good. Okay, I can look at her shoulder. Which way do I need to put her? There. I can look at her shoulder, take her into full extension, come backwards. There we go. Full flexion, right? So I've looked up the chain. Now I'm going to do that with all 4 joints, right? But then the other things I'm going to look at here is, okay, so she's got carpal arthritis. So what are some of the soft tissue things that I might find? And I always find it's really helpful. And I would do this when I was teaching, when I would teach vets, and I once had this when I was teaching a bunch of vet students at the University of Calgary once. I got them all down on their hands and knees. Actually, I tried to find a picture of it because it was hilarious. Anyway, so it's all these vet students on their hands and knees, and I'm like, okay, now I want you to be lame on your left hind leg. So they all kind of offload that leg. And I said, now I want you to try and take a cookie from your right hip without putting your leg down, right? Well, they can't do it very well. So then you start thinking, well, now if you're lame in your right hind leg, what does that do to your spine, right? Because it makes your spine crooked. So then I start looking for things. So as a physio, then I start looking for things in the spine. I start looking for, posture. How is this dog compensating? And so if we've got a problem at the carpus and they start offloading, so moving their weight more towards the back end, so we might have problems in the lumbar spine. We might have issues, trigger points, let's say, in the thighs, in the front of the thighs. So I start looking at all of those pieces, right? So it's all of the components, because I want to see not just the arthritis in the carpus, but what are the I never get it right where my body is in this frame.
I know.
So what are the compensations that are going on? And in some cases, what are the causations? So might there be some reason, and down. Might there be some reason why she developed arthritis in this carpus?
Yes.
So I have an example. I had one dog that I originally started seeing her when she was 3. And she had arthritis in the elbow, one elbow. And elbow arthritis is so hard. It's just,
So hard.
I hate elbow arthritis. It's one of those where it's like, oh.
Mm-hmm.
So then what happened over time, and I knew this dog from the age 3 to like 15 and a half or 16 when she actually passed away. But it then went from elbow to the opposite carpus and the opposite foot. She ended up with one of those, those giant feet where they're weighting so much that they've almost flattened down.
They're almost like web jazz hands, aren't they?
Yeah. So that became something that we also had to treat. But it's one of those where if all I looked at was that big flat foot and not, so let's say I saw her 5 years later and all I noticed was that big flat foot and not the elbow arthritis, then I wouldn't necessarily be treating the whole problem.
Yeah.
Part of the problem is looking at what's there, what caused it, and what it is causing.
Yeah. And that's why it can work really well with vets. So vets it's a completely different experience. When you go to the vet, you generally have less time. So how long do you spend with your clients?
Oh, an initial assessment, we book off an hour and 20 minutes.
There you go. So a vet's going to have 10 to 15 minutes. No. And they also are, it's not that they're not looking at the whole dog, they're looking at the dog systemically. So they're looking more internally. So they're going to be looking at kidneys, liver, they're going to be looking at respiratory, cardiovascular, they're going to be looking at teeth, ears, eyes. So now you can see that they actually work brilliantly together because they look both together looking at a dog holistically, the whole dog. So yes, physios rock, they're great. Now let's talk about manual therapies because everybody's going to go, don't you mean massage? And I'm like, no. So manual therapies is massive.
Right.
Let's just talk about a few bits and bobs. So people are going to go, wow, okay.
So you could pretty much put manual therapy in a category of therapy that you use your hands, right? Manual therapy. So basically in there, you've got your massage, but you're also going to have your range of motion and stretching. Okay. You would have your mobilization and then the manipulation side of things in through there as well. Okay. And so with the massage, then you've got all sorts of your myofascial release, your trigger points. You could, now I was going to say you could put dry needling in there, but it's not really because that's a needling technique, but it to affect a muscle system.
Yeah. So just tell very briefly, because we're going to obviously show people bits and bobs, or should we do it as we do per joint? But
whatever.
No, quickly tell people. So what massage is, what you mean by range of motion, because people won't know that. What do you mean by mobilizing, and what do you mean by manipulating? Because people are going, there's just lots of M's in there.
Okay. So your massage, you are basic. There's my hand again. Okay. I'm like, why can I not get my hand right in this screen? Okay. So your massage, you are basically massaging the soft tissues, right? Yep. So mostly your muscles, right? But your muscles, you're going also through the skin, you're affecting the fascia. You would have an effect on tendons and all that as well.
That face was like,
shut up. Oh my gosh, do I have to be here for how long am I doing this?
She's like, I hope you're paying me.
I hope you're paying me. Oh, I am. Okay, there's one.
Good.
There's two. Okay, there we go. We got her for another minute or two. So it is working on all those soft tissue systems and massaging them, which will increase blood flow superficially at some level. It will do that, and everything we do affects the nervous system.
Yeah.
Everything we do affects the nervous system. In fact, I had seen a quote somewhere as like basically like we can think everything we want to think about all these other mechanisms of how things work, but you know, in the end, it all boils down to an intact nervous system.
Yeah.
So.
Yeah. And that's exactly what I've heard. And I quite like that, the way they were like, at the end of the day, guys, you know, it's you affecting receptors, sensory neurons, and a feedback loop. That's what's happening, you know, so that will change the circulation. That is going to affect muscle function. Yes. But yeah, so you're using kind of like your whole hand and you're really getting in. So what's mobilizing?
Let's see if we can get her calm down. Okay. So we'll massage her like this and see. She's buying this. Okay.
Do you know what that reminds me of? Have you ever seen that where people try and put somebody else's makeup on from behind?
Oh, yes.
It's very much like what it looks like at the moment. Lipstick.
Yeah. Okay, so that's our massage. Let's go. Your range of motion, okay, is basically just taking the joint through its full available movement, right? Yeah. So full flexion, extension, or, you know, rotations if the joint permits that, of any joint. Stretching is then, it's almost like range of motion, except you are understanding where the muscle code starts and where it ends, right? So then you are looking at, so for example, I can do, there we go. I can do, there we go. Kind of, there's her elbow. I can do shoulder, shoulder flexion.
Yeah.
There we go. Right. Which also stretches my supraspinatus tendon at the front. But if I want to stretch biceps tendon, right, it crosses the shoulder joint and the elbow joint. So, she's just not, let's get you up for half a second. Right. So a bicep stretch is more straight leg alongside the body. So
and why would you want to stretch something? What's the benefit of doing that? Just keeping function, keeping range, keeping
function. You do get some elongation of the thought is you get elongation of the muscle fibers. Newer research is telling us you're just making the muscle neurologically more adaptive to doing that. Then there also is a thought process, right, for lymph flow through tissues. Usually you can do it by muscle contractions, but even if you're just stretching and releasing and moving stuff, you know, all of the fascia, the muscle fibers, everything in there kind of moves.
Yeah.
And tissues need to move to be healthy. We know that, right? We know that if you're just a big blob, never moving.
I think that is the biggest take home, guys. Even if you have no intention to pursue manual therapies, if you have no intention to touch your dog with intention, please remember to keep them moving, because terrible. And I can totally relate to it. Now that I'm laptop lady, I'm so boring. I'm like, laptop lady. My physical self has gone to toffee. I am like getting up going, oh my God, my back, oh my God, my hips, because everything is contracted and in a sitting position and it's not moving enough. And I have had a dramatic change because of a sitting position a lot of the time. So what's mobilizing?
Okay, so now mobilizing is moving a joint through what they say is, again, rhythmic oscillations, right? So if I go with my wrist, maybe I'm a more willing participant. Okay. So if I go with my wrist, I can, and I'm nice and hypermobile, so you can actually kind of see it. Okay.
Wow.
So if I traction my wrist, right, this is a mobilization. I am moving it. I'm moving the joint itself and how the joint would move. And over here, I've got my bones to show you too. So you can kind of, then now she's interested. Okay, so this is an elbow. Okay, so this is an elbow. So, you know, range of motion, we're flexing and extending. A mobilization might be trying to distract it this way. Okay, and I will exaggerate it because that can't happen. That can't happen, right?
It would just really hypermobile.
Right. It would just be teeny tiny little I can't even make them small enough so you could see, but teeny tiny little motions, because in the end, all you're actually trying to do is stimulate the nervous system in the joint to help to settle down what I would say is the firing of that joint, settle down the messaging that comes out of that joint, how much that joint is crying out, oh my God, I hurt. I always call it the 14-year-old girl.
I love this. Please do it. I've heard this so many times and I love it. Just do it.
So the 14-year-old girl, and it stems from an actual patient of a 14-year-old girl. And I was assessing, I think it was her knee. And I was like, everything I touched, now, does that hurt? Does that hurt? It's like, oh yes, oh. Everything was over the top dramatic that it hurt. So I finally had to say, now, what is your worst hurt? But the point is that when your joint is irritated, so whether it's arthritis or anything like that, it's like you've got a 14-year-old girl trapped in your joint that's just basically everything that you do to it hurts, and it's just drama all the time. Mm-hmm. So what we're trying to do is just change anything, change the system, change the nerves so that your body stops listening to the 14-year-old girl and says, okay, well, actually, that's not that bad. Actually, yes. I'm okay.
And I think for a lot of people that are watching this, they're going, wait a minute, I thought with arthritis you needed to rest. You really needed to rest. So there's the proper, it's not that it's an old wives' tale, but it's a bit like that 5 veg and fruit a day is a good thing for you. It's just giving people a very broad advice that they just hope will help everybody, because it's such a wide range of conditions. Elbow arthritis in 100 people is going to be very, very different in those 100 people. So they give this wide range of advice of rest. And actually, that's not really what we want to be doing. We want to be changing what we do with it, not stopping what we do with it. And I think people need to really take home that rest from a vet means stop the impact forces, stop, irregular
throwing
movements.
The chuck it in the park.
Yeah, but movement, predictable, gentle, not too concussive movement is good for the joints. And I think a lot of people around the globe immediately start resting their dog and not letting them do anything that's just going to make them more stiff and more uncomfortable. Yeah. So joint mobs are amazing, but they are better in the hands of a person that's professional. So I would definitely say the stretching, the mobilization, and the next one we're going to talk about, manipulation, definitely in the hands of professionals. So tell them what manipulation is.
So a manipulation would be, I don't know if I got a joint, I'll do this, right? Where you would take the joint to the end range, and it's like a fast, high velocity, low amplitude thrust. So it's like, oh, I got it. Could you hear it?
Yeah, totally heard that.
I was like, oh, I hope it's going to work. Okay. So it's basically like doing that on your finger, right? That's a manipulation, right? So you've basically taken it to the end, you've given a little extra, and that changes, and again, it changes the pressure in the joint. So a lot of these things, even on the human side, we are coming to recognize that it's not how we were even originally taught, right? So it's not that I'm changing the position of the joint. You are changing the pressure in the joint and the feed output from the joint.
Yeah, definitely. Because I must admit, for people like me, so when I got interested in arthritis, that's such bad English. When I got interested in arthritis, when I became more interested in arthritis. So when I became more interested in arthritis, I found it hard to believe a lot of what people were saying when they'd be like, well, I've just realigned the spine. I'm like going, what? No one can do that. That's crazy. So I must admit, I was really skeptical, and it's only having been on my journey, and I've been on this journey now for 7, 8, 9 years, I can't even remember, that I'm starting to kind of get it. But I think sometimes the terminology can be really misleading, because it's quite brave. I've just realigned the spine. You're like, whoa.
I know.
That's a statement. As you say, you're kind of affecting the nervous system. Okay.
it's hard to explain what you're doing using all of the really complicated nervous system descriptions to non-medical people. Because I mean, I even found that I said, okay, there you go. I just, I fixed the pelvis. Well, there we go. It looks level again, because that just is easy to come out of your mouth, but it's like that's not the reality of what's happening.
No. And I think people can really, believe that, because you just imagine someone like building and scaffolding, you just done. Yeah. Anyway, we will continue to expand that kind of understanding and not get engrossed and down a rabbit hole.
Okay.
What we're going to do now was that we decided we'd go through joint by joint.
Okay.
The sort of things that you would be thinking what you can do with your hands. Now, guys, this is really important, and this is really important to me because I don't want you to get me into trouble in any shape or form. Just because of what Laurie's talking about doesn't mean that you're going to go and grab your dog and start trying this. What we're trying to do with today is just give you an insight into what is available to you. So we're very careful what we put out. We don't want to give people the belief and the confidence that you can just go and start the dog's body. No! Okay. What we will do is give you a few tips about things like effleurage, skin rolling, very gentle techniques, maybe a little bit of deportment, that sort of stuff. But when Laurie's talking about what sort of things she tries with each joint, it doesn't mean that you should go and start trying to do it. It means that you're going to have a better understanding. So therefore you can find a professional that then can introduce that to your dog. Okay? Promise me. Right. Let's start with digits, because I strongly feel digits are just so neglected. And when I started, I was looking in the veterinary textbooks for stuff about digits. There's nothing. And I'm like, wait a minute, we see nothing but jazz hands. Loads of jazz hands. And I can't imagine walking full body weight on arthritic, inflamed toes. So we've already had the lovely Julie. Julie is so helpful to Cam, by the way. Thanks, Julie. Digital OA, what sort of things do you think about doing?
Okay, so first, okay, we also talked before, we were saying, so when there's arthritis, it's always multimodal. So I want to make sure that the dog is on some sort of a pain medication or an anti-inflammatory. So that is important, as well as a joint supplement and all of that. So
I don't know whether Karma's actually kind of going, shut up.
And exactly. I'm new mom. Shut up, new mom. So anyways, and then also you've got your weight management and okay, that's not why I'm here. So what I like to show people how to do is just basically tractioning a digit, right? So find a toe and even just give it a little pull. Let's do this toe. A little pull out. And it should always be gentle. The dog should not be worried by it. But if you had, I don't know, if you've ever gone to massage and they kind of give each of your toe or fingers a pull, anyways, it's like, or a hand massage and they do some of that, it's like, oh my God, that feels so good, right? So just even a gentle pulling on the toes, and you're basically opening up the space. You're opening up the joint space in through there. Now the thing with doing your toe pulls is, one, you always have to have dog compliance, and two, think about it as being slow and calming and rhythmical. I always find that in the clinic, if I'm mobilizing anything, a neck or whatever, if I can mobilize it to the music that's playing on the radio, the dogs are always way calmer.
Yeah.
And I think because they recognize it's predictable, I'm not going to go crazy. It's just, see, look, you're even swaying right now too.
I am. I'm just watching. I'm like, yeah.
Irma's like, oh, there we go. So it's very calming, right? So the digit traction, I find, is one that I absolutely love to give to the owners for the toes. And then otherwise too is looking at like cushioned booties.
Mm-hmm.
So cushioned booties would be something that's great for either going on walks or in the house. I've got a dog right now that I think has a bit of a sesamoiditis, right? So dogs they have bones underneath here too.
Mm-hmm.
And I think one of his is inflamed. So we've got him wearing booties for all the time, because it's not going to get better unless it is not continually irritated, right?
Yeah.
So the same would happen for these toes as well. If you can have some cushioning, that would help.
That's like gel inner soles. Like my mum's she's got Morton's neuroma at the moment.
Oh, that's a nasty one.
So she's got the gel insoles to just try and prevent any aggravation there. But just you have to tell me which booties you use, because there's a lot on the market that are cumbersome.
Yeah.
They're not very well made. They're very cheap, and a dog might actually have other problems where they're not picking up so well. So don't put these things on and just going, done, fixed.
Done.
You need to actually check that they work for your dog.
You have to be careful because, well, at least over here and you guys, but you don't even have this same clue of what we have to deal with. Like there would be winter booties. You have no idea. Okay. No. So your winter booties are likely a bit too cumbersome, right? Yeah. So what you could do, TheraPaw makes these ones called, I think they're called Cushy Paws, and they look like they're more like slippers, right? And there is a TheraPaw UK. So you can look at that. Or I just had my client with a sesamoiditis. She has this lovely polar fleece sock for the dog that is Velcroed on. And then I had given her some padding, and she just basically made her own. So it's padding inside of a tube of polar fleece. And then it's the cushioning. And then she Velcros it onto the leg just above the foot. And that's enough that it does the trick.
That's nice. We're there's a new brand out. Have you heard Scandi? I think it's called Scandi Vet or Scandi. And I got a load of samples, and poor old Luna is the experimental dog. So she's wearing booties all day. She was like, oh, for God's sake.
Take the booties off.
She did.
Let me be naked.
Yeah. Let me spread my doors. Okay, so toes, things that I'd like to add to toes is don't forget your interactive feeders, because like Kongs, positioning, they're going to actually put weight on and hold that Kong in place so they can get in, and they're going to naturally curve around. So that's a really easy passive thing to do. Some people like digging sand pits. Warmth is really good. Think about pre-warming them before you do anything to them. And if your dog's going, please don't, then don't. If your dog really is like, please don't, then just leave be. Okay, let's move up to the Carpus. What sort of stuff do you do with the Carpus?
So, and I should say, for any of these arthritises, as a rehab person, I would also be doing laser, potentially shockwave, but not on the digits. I find they don't tolerate that very well. But Carpus, or in the back leg, tarsus and above, tolerates a shockwave quite nicely. Mm-hmm. Sometimes acupuncture, depends on the dog, and then your manual therapies. Pulsed electromagnetic field, and that's another one that people can buy, the little pulsed electromagnetic field loops, and put them on their dog for treatment there.
Yep. So we can talk about them, definitely. That's a big topic in itself. We've done a little bit of work with David Somerville about different therapies. So I'll put links to them. Cool.
Carpi. So what you can do for the Carpi, willing victim again. Okay. So this one, what I like is attraction. And I think I will get people to do either where are you? There. Oh, no, here. Okay. A straight leg traction like that. So straight or even bent, and then tractioning it this way or this way. Any little pull. How's this? Any direction you want to pull on this Carpus, as long as your dog is happy, is a willing participant, and you're not taking it to the extremes of any motion. But this is a nice, easy thing to do for the carpus. This is a nice mobilization for the carpus.
Mm. And
So,
gentle and kind.
right. And then as we talked before, right? So that's directly for your carpal joint, but then you're going to look for the other compensations. So if a dog has a carpal arthritis, they might be leaning backwards. So you might then also need to look at the back and the spine and massaging along the spine. So we'll get there.
And if you want to know more in detail about that, then we did a brilliant live with Michelle Broadhurst, because we were talking about myofascial. So we talked about compensation a lot. But hopefully whoever follows Cam now realizes that we have amazing people like the lovely Laurie come in, and there's a lot of overlap, and you start getting the same messages from everybody. Okay, elbows.
Oh, okay. So my elbow thing that I would manual therapy or traction, and what I've decided to show you guys is mostly all the traction stuff. So I'm going to get her upright. We bend her. I try and get the hair out of the way. There. There's an elbow. There's the elbow. Okay. Bend it to 90 degrees. Get it out of my name. And I'm going to push down that way.
Yeah.
So this hand is holding above the elbow. The elbow's bent to 90 degrees, and the other hand is below, and I'm kind of just pushing it downwards like that. Right. So that's the one I showed you with the bones, right?
Yep.
And don't worry, it doesn't have to go far. It doesn't have it shouldn't.
No, that's what I was just going to say. It really shouldn't. It's literally you're just trying. You're gently waking the joint up. It's like going up to somebody in bed and just going, morning, you there? And so they don't go, but you have to, all of these things still would very much prefer you to speak to a physio, have a physio on board with you. Don't want you going off and just starting to pull your dog around.
Right.
I think what we're trying to do is go, if you see a physio and they start looking at your dog holistically and start showing you these areas where there needs to be attention, look at what you will get out of having seen a physio, because they're going to leave you with all these possible tools. Right. And I think that's the best way that I can put it, guys, in that I know some people will go, oh, it's going to be 50 quid to see a physio. What am I going to get out of it? Loads, because they're not only going to be treating your dog, they're going to be looking at things that you would have never considered. They're going to be planning your exercise. They're going to be helping you with weight control. They're going to be looking at your house and your lifestyle, and they're going to give you tools like this that you can do. And remember that word I said, rebuild. It might be that you as an owner used to throw a ball, you used to go on big hikes, and you're thinking, can't do that anymore. What can you do instead? This can be part of your new bond, your new relationship. So don't go and grab your dog and start pulling their elbows around. I want you to understand there's a lot out there available for you to do. Okay, but yes, it's also waking them up gently, not okay, good.
Then the other thing with elbow I just want to bring up is all of your elbow dogs end up with soreness up here in the lats, right? So your lats are I call them the monkey muscles, right? That keep you from hanging up on a tree. So these guys here, which in the dog end up being behind the shoulder in here. Mm-hmm. So then these become ones where you're stretching like this or massaging around the back of the shoulder blade. Mm-hmm. Can be great for those ones. So your elbow arthritis dogs end up with a lot of compensations, lot of compensations.
Yeah.
How they move their leg forward changes, the muscles they use to pull themselves forward change, and often how they, there are also ones that rock backwards and put the weight more to their back end as well.
Yeah. And I think for me, that area, owners can really get involved with their physio's advice with the skin rolling and the effleurage and stuff like that. So again, having seen your physio, you're going to be able to go, well, what can I do? And they'll be like, right, well, this is a section that's pretty safe. And you're going to be able to do stuff while sat down in a nice calm room, and you can do some skin rolling, some effleurage and stuff like that. So that's cool. So what sort of things do you as a PT think about with shoulder?
Okay, so your shoulder dogs, Well, they tend not to be going into full ranges of motion themselves, right? Because usually full extension hurts and full flexion hurts. So they kind of stick in this choppy little area. So they end up with all the muscles, kind of the top of the shoulder blade, get really, really tight. They tend to hold, everything is all kind of held up like this because they're not moving as much. And another one then that can work quite nicely for them is even just like a long leg traction. So I'm holding her up here and it's just like I'm tractioning the whole leg down. You're going to open a little bit of the, wherever it is, where we'll just say it's there.
Yeah, I don't know whose hair you're touching at the moment.
I know. So you're going to be opening up the shoulder joint a little bit, but you're also then stretching out the muscles at the top of the shoulder blade too. Mm-hmm. So a nice distraction like that can be quite comfortable and calming, likely with the dog lying on their side, but then you won't be able to see.
No. And that, I think that's when I started learning. I think that was one of the ones that blew me away at how much the dog would be like, thanks, God, that's nice. Because we don't see that over the years they're starting to do this and everything gets really tight. And so those ones are, again, lovely. Again, repeating myself, this is done with the support of a physio. This is highlighting what is available out there, not go and start doing it. What about the intersection between the shoulders and moving all the way down?
Okay. Well, so if we go neck, and this is one where it's like, okay, you definitely want to have somebody showing you how to do neck traction if there's arthritis in the neck. So I'm like, I'll just do that and say, well, there you go. Because that one is definitely, you know, if I show that to an owner, I show them how to do it. There's lots of explanation. And then I say, now you do it. And then I coach them through, okay, you need to slow down, move your hand different, let your dog relax. But also I will say neck traction can be great for an arthritic neck.
Yes. Yeah. And then a lot of people will potentially combine that with cookies to the hips and neck bends and stuff like that. So, and I think
you can massage the sides of the neck.
Yeah,
absolutely.
And they really like it up around the atlas as well. I think people don't realize how much tension they get at the caudal portion of the skull. Yeah. And when you start really feeling your dog, you'll start to pick up on your friends' dogs when you're like, oh, there's a bit of tension in the neck. I think there's something going on here. But I think people really forget how much the neck has to start overworking. If you are weak in your back end and you're trying to go from a sit to a stand, you're going to use your neck to throw your weight forward. You're going to use your neck to throw your weight back. If you are lame, you're going to be flicking your head up every time you're trying to offload. And the neck joins in a lot. And I think a lot of dogs would love their owner to learn techniques for massaging neck. Okay, so what about things down the back? You as a PT do. So this is where I get a little bit like, don't let owners do too much, but there is certainly stuff that they can do safely.
Well, I'm going to show you the one that I think the owner can do. And that's for the thoracic spine. So up in this top part of the back, right? Mm-hmm. So, and if we say it might not be that this is the root of the problem, but in all of your dogs that have hip arthritis, stifle arthritis, or let's say a disc disease and they've got weakness in the back end, any of the weakness in the back end, any of that stuff, they become front wheel drive. Mm-hmm. And in becoming front wheel drive, not only do they have soreness in those, the lats muscles there, but this whole thoracic spine is overworked and sore. So I feel that it's safe to show owners chest lifts.
Oh,
my lovey here is so good but is basically, well, you got to know she has a head. So there we go. She's got a head. And then if I find the spot behind her front legs, right, and I just basically lift her up, she's not coming off the ground. I'm just lifting her up so that she rounds this part of her back. So if I get my arm out of the way and you see we're rounding, there's my dog, rounding that part of her back. You can kind of see a little bit. That is opening up the vertebrae, opening up the facet joints in the spine, and they love it, and it just puts the tension, gets rid of the tension in through there. So it's not only stretching some of the muscles and the soft tissues and the ligaments along the top of the spine, but it's actually opening up the joints in the spine.
I want someone to do that to me.
Me too. Just so that I don't have to do it to myself. Yeah.
It does, right? It's so yoga-y though, isn't it?
Yes, it's yoga-y. It's
yoga-y. Okay, so now we're moving back.
Okay.
And again, guys, this is not the complete encyclopedia of a PT. This is really not the complete. This is the sole intention of tonight is to open your minds, okay? Because I have so many conversations with owners who are investing in pain relief. They're investing in maybe some supplements there, and they start going, well, is it really worth it? Is it really worth it? And I think just so people understand what tonight's about, is about highlighting how much can come out of these appointments. Okay, you're not going to just have someone go, done. See you later. See you in a month. You will have
the goal. Yeah, the goal should be to empower the owner, to empower the owner with knowledge and some techniques and skills that they can be helpful at home.
Yes, exactly. Okay, so we're now at the thoracolumbar. We're lumbar spine now, heading towards the pelvis.
Here. So my favorite is going to be tail pulls. And so I'm going to hang on to her little bottom, her buttocks, not quite anywhere else, just the bony butt there.
Yeah.
And grab a hold and a nice slow traction.
Yeah.
Just nice slow pulling her tail. And so we can think, or quite likely imagine, but it's likely pretending, that we're opening up the spaces, but really we're having effect on the fascia, maybe the dura around the spinal cord to a certain extent because of all the nerves in the tail. But this is really nice. I get the owners doing tail traction for a lot of the stuff that it is thoracolumbar and behind.
Well, now anybody that's been following my Holly's Army lives, they've met Derek, my 20-year-old cat, who at the moment is just ambushing me all the time. And I think it's tail pulls, which is like the biggest incentive for him to not leave me alone, because he absolutely loves tail pulls. He had a femoral head and neck excision when he was about 6. He's terrible back end for a cat. He's like, oh, that's so nice. Okay.
I would like it. I think I would like that one too.
Something that I love doing, but a lot of people don't do. I do a lot of tapotement over the lumbar spine, very, very gentle. Really, really gentle jungle drums, and the dogs kind of tend to kind of go, quite like this. That's quite nice. And then I can get in and do other things. But people are like, what are you doing? I'm like, just distracting your dog.
Just jungle drums.
Yeah. So, and then, okay, let's head to hips. Yeah.
Oh, the hips. Okay. So these guys, I kind of do the same thing for the hip as the shoulder. From a manual perspective, as I can do, a long leg traction, pulling the leg down like that. But a lot of the time for hips, I find that they've got muscle pain in their glutes. Mm-hmm. So if you go, here's the front of the pelvis, and here is the hip bone, the side of the hip bone, and pretty much right in between there are the glutes, and they're sore in all, she likes that. And they're sore in all of these hip arthritis dogs.
Yeah.
So any kind of massage, anything there. Yep.
Don't stiletto them. Okay, guys, think about a stiletto on somebody's chest compared to a nice flat shoe. I want the flat shoe.
Yeah. Yeah. Multiple fingers. Mm-hmm. Yeah. No. So that's my favorite for the hip, and everything I do in the hip is, so much of it is right at that muscle, the deep gluteal particularly. So anything I would do, I would laser there. I'm going to acupuncture there. I would dry needle there, shockwave there. And there's an acupuncture point right there. It's like it's designed for, it's actually on the deep gluteal, right? So from an anatomical perspective, it makes sense why that is an acupuncture point for the hip.
Yeah. I'm just doing an acupuncture course. Is that on the bladder line or something like that? I think it is.
This is gallbladder. Gallbladder 29 and gallbladder 30.
Yeah, I was nearly there. I've got a long list of learning. Okay, move down to the stifle. So what sort of things?
Stifle. Okay. And I'll get to that. Okay. So stifle then I would say you can do, little bits, the same as we did at the elbow. You can do little bits of traction that way. And I would say go really, really gentle, really, really gentle. But where the muscles get sore from stifle is you will have soreness up the front, right? So this muscle here. So you've got your sartorius and your tensor fasciae lata, which I brought my fake dog in, right? So up in here.
Yep.
There we go. Look, this dog doesn't need any treats.
Yeah, it's so well behaved.
A 2 on the Purina scale. Okay. So anyway, so this is where they get sore in through here. Now, knee arthritis and hip arthritis, they all get sore up at the front. Okay. So they all start to offload differently. And sometimes they're hip flexor muscle too, the iliopsoas, but that's a hard one to find unless I will say that in teaching vets, that's a hard one to even to teach. So there's a lot of, it's a difficult one to find, but just you might go to your rehab practitioner who, might show you how to find it if they find it's a problem and show you how you can get in there.
And I would warn you guys, don't now go and pick up your dog and try and find its iliopsoas because they're often sore. They're often very sore, and your vet might not have picked up on that. You might not be seeing a physio, so don't go and suddenly put your fingers in there because the dog will have every right to turn around and have a go.
Tender, it's very tender.
It's very tender. Okay, so now we've gone down from the stifle and we're down at the hock. Okay,
so this one is like your carpal joint, your wrist. So if I take my little leg at a 90 degrees here, then I can move it this way. I can move it that way. Any traction.
Yeah. Right? I think what I forgot to tell people when you were talking about mobilizing, most people are going to think that a joint only moves in the range of motion. So most people think that joint literally only flexes and extends. And so no, it doesn't. It has loads of little more oscillatory movements. It translates a little bit, it ducks, it abducts. There's lots of other little movements, not just that one range of motion, flexion, extension. And what you're trying to do with the mobilizations is take advantage of those micro movements to, as say, reprogram the joint, to try and trick the pain nerve endings that are firing away, going fire, 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 pain. You're doing little micro movements. It's going, oh, joint's moving. And the brain goes, I can't listen to both. What's more important? And they will listen to movement rather than pain. So you can get like a reprogramming of the system. It can give you a short break. It can relieve some of the discomfort. So don't think that you're physically rebuilding the joint. You're not trying to go that's not what you're doing. You're trying to distract the brain, if that's a better explanation.
And then the other thing we need to say too is that you're not doing this for hours on end, right? You are likely only doing this for, at max 5 minutes, but quite likely 2.
Yeah, exactly. So this is what Cam's trying to do. I think I'm trying to justify myself for fear that people are going to go, oh my God, you shouldn't teach people this. What we're trying to do is really open people's imagination of the multimodal approach and what it really truly can mean. And what frustrates me a lot is people believe that you have to just keep putting your hand in your pocket and buying things to make things better. And don't get me wrong, there's enough bastards online that are willing to take your money to do that. I don't mean to be rude, but you can buy product after product after product after product. And there's actually so many things that you can do within your home, within your exercise regime, within your dietary regime, within your manual hand capability under good guidance. And you can make a massive difference to your dog. So I hope I've clarified that. Just let people know what sort of more skills that you personally do before we kind of call it a day. And no, we do our must do's and must don'ts, because what Laurie's just shown you is seriously the very, very top layer of what PTs do. It really is so much deeper, so much more complexity. So I got to know about Laurie because of your spinal stuff. You know, I was just like, my God, that's crazy. But you do a lot more complex stuff with your hands, don't you?
Oh, absolutely. Right. So what I'm showing is really just kind of a traction or a distraction. But, you know, there's all sorts of other little movements that can happen in through there. And there's, you know, for lack of a better term, it's the art. It's the art of the medicine. It's the art of the physiotherapy that is the finesse of it all, where it's looking at, well, what is my goal? Am I doing a grade 1, grade 2, grade 3, or grade 4 mobilization? So I think about that. I think about, is this a chronic or is it a acute? So am I doing a grade 1 or a grade 4? I think about, what is it I want to accomplish? So am I doing it slow and teeny tiny, or is it really chronic and I'm, you know, being more aggressive? And this is also where it's good to have somebody that can work with you. And even if you don't have someone local, there are rehab people that will do online consults and can work you through stuff. You know, so that is an option, because we know not everybody lives near somebody.
Yeah, and that's a big problem. And I think a lot of people need to know that often there is a homework plan where it's not just the work on the body, then there is the non-hands-on stuff where it's maybe the weight shifting, the balance work, just gait retraining, all these things that go along with it as well. So this is just one part of what PTs do. So hopefully PTs will be happy with this, that we haven't done anything wrong, rather than just
ruined the whole profession.
No, it's all about unity. It's all about us all working together, respecting what each other does. So what about the must do's and the must don'ts? Let's start with the must don'ts. Yeah.
Okay.
Let's say with massage.
Should never hurt.
Yes.
What you're doing should never hurt, right? So it should not be about pushing it so hard that the dog is in pain or trying to get away from you. So it shouldn't hurt.
You shouldn't do it over any kind of wounds. So
you're on massage.
Yeah, I didn't. Yeah,
you jumped.
I did. I'm sorry.
Yeah, no. So you're massaging that. Yeah, you're not doing it over any wounds or anything like that. I thought we were more global. I was going to say for walking, right? So people would say, well, how much should I walk my dog? He's sore. You've got to figure out what's right. So my rule of thumb is, if you know what makes your dog sore, reduce from that. Maybe you cut it in half, and then you see the dog should not be more lame, which is not grammatically correct. Lamer is correct, but that sounds worse.
That sounds worse.
I know. So the dog should not be more lame when it comes home from the walk, or that evening, or the next day.
Yes.
And in my head, that's your cue, and you build up or down from there.
Yeah, I'm going to tell you what's in the owner's course. So I've just written an owner's course, which is 12 modules of just really short, sharp fact about different areas. And in the exercise bit, it's proactive, reactive, reflective. So proactive is looking about your walk, what exercise you're going to do, what terrain are you walking on, what the distance you're going to cover, who you're going to meet, what activities you do there. Think about what you're asking your dog to do, because as soon as they go outside, the brain chemicals will go off and they might not be truthful with how they actually feel. Reactive is actually watching your dog walking. Don't get your mobile phone out and start speaking to your mum for half an hour. Observe your dog and look for those cues that it's time to go home, or actually may have been time to go home 2 minutes ago or 10 minutes ago.
Yeah.
And then reflective is actually look back on what impact it's had on your dog when you get home, that evening that you're home, the next morning. And that should equip you to start taking the reflective information into your next day's proactive or your next week's proactive. So it's a cycle. So just remember that, guys: proactive, reactive, reflective, and just keep cycling it, because it's a changing picture. Must do's. What are our must do's?
Movement. They need to move. They need movement. They need exercise. The joints need to move. Movement would be, from a physical therapy standpoint, number one, right? And then you've got your other aspects of, you need to make sure that they are not overweight. So you've got to deal with the weight management. You want good quality food. You want some supplements on board. You want pain management on board.
Yeah. And I think what's really exciting, so when I started CAM about 5-6 years ago, I was a bit doom and gloom. I was like, oh God, my toolbox is really empty. And actually, good God, the toolbox is getting very full right now. I don't even think I can close the lid now, because there are so many things that we can do. And what's good is that more and more practices, more and more rehab centers, more and more therapists are available for people to actually explore these. And what's really nice is I think people are beginning to see importance. These aren't the cherry on the top. So you haven't made this massive cake and the physio is just this tiny little cherry that's there for show. Actually, the cherry is within the whole cake. It's a really important part. So I think that's amazing. I think we did that okay. I hope that we're not going to have anybody go, oh my God, you've destabilized my dog. That's not the intention, guys. Do not start pulling your dog around. Get a physio on board, get a therapist on board, speak to your vet, be sensible. This is just a taster of what is available that you could introduce into your dog's lifestyle. Do you want to do 10 top tips, or do you want to bail? Do you want to bail?
I'm going to bail on that. Oh, you made me do that last time. And I'm like, it's all the same, right? Does anybody have different ones?
You can throw some real shockers in there. Okay, I'll leave you. I won't.
You know what? Last time you had me on, I actually stressed about it and I wrote them down. And this time I didn't even think about it. So then I'm like, okay, I'll just try and come up with something comical. But we've been talking too much. I haven't come up with anything else.
That's fine. I will let you off. Just give us one tip then. What is Laurie's tip? And it can be something you've already said, which is the big take home.
Well, I said movement.
Yes, perfect. I love it.
Yeah. Movement and, brush your hair before you go walk your dog, because people should care about what they look like still. I think that's important.
Are you saying something? This is lockdown hair.
No, I just think that people need to just every now and then, just even though they're walking their dog, just still put on some lipstick.
Do you know what? In the UK, I think most
people... Oh, no, in your mouth. Okay, so mascara.
Yeah. But I think most people in the UK have got pretty complacent with how we look, because we've been locked down now for so long. We need to tell them about your course.
Okay. So I have a massage course for dog owners, and it is specifically so that you can massage your own dog. It's not to give you certification or anything like that. And it's not to replace your typical veterinary or your important veterinary care or rehab person care, but it's to empower you to do something with your dog.
Yes.
So, oh, no, I put the cookies up here and she's looking for them down there. Okay. So, what we have done for the month, for basically the 14th to the 14th, is we're giving CAM a portion of the proceeds to help with all the fabulous things they do. So I made this because it is the real link is terrible. Well, there. The real link.
And I will put the link in the thread as well.
Yeah. So likely easiest for me to say is if you go to, let me go down. There we go. If you go to caninefitness.com and on the left-hand side, there we go.
Suddenly the lights come on again.
Mood lighting.
Oh, yeah.
Okay.
Yes.
If you go to www.caninefitness.com, all spelled out like that, And on the left-hand ledger of items and topics, there is muscle pain and massage. So on there are 4 free videos for how to find muscle pain, which in and of themselves is very useful. And then it links to the massage course if you are interested in taking that.
Yeah.
So
perfect.
That's what I've got for you.
Well, there's a lot of people that follow CAM now from lots and lots of different countries that don't have PTs readily available. They don't have therapists readily available. And I think it's very fair to suggest that there are resources available to them. Here in the UK, we are very lucky. We do have a lot of therapists available to you. So there are massage therapists, there are physiotherapists, there are hydrotherapists, there are laser therapists, there are acupuncturists. And what I would strongly say is start off with somebody with experience that's going to really be able to help you look at your dog and really tailor, because these people have got years and years of experience and further training, and they will teach you so much. I have learnt so much from hanging out with these souls. So don't overlook them. Definitely look into employing their services. Thank you, Laurie. I hope people enjoyed that.
Oh, good. Thank you for having me.
No, it's always fun. It's always so fun. I just feel like I'm in a living room with you. It's easy. Cool. So, guys, this week we have got a really big topic. We have got the lovely Kathy Murphy joining me to talk about canine dementia. And I know that's a lot of you have issues with that with your dogs. So please do come and join us. I think it might be Tuesday. I can't remember. We have an events section on the Facebook page. Check there. But Kathy is brilliant. She's absolutely fantastic. Cool. Right. There's no questions. So I'm going to see you all later. Bye.
Bye.